Hello, welcome back to my channel Med Connection. This is Dr. Sugandha this side. I work as a doctor. We have been doing a series on diabetes, and in our previous videos we have spoken about what is diabetes, what are the different types of diabetes, the complications, the causes, symptoms, risk factors, all these things we have discussed in our previous videos. In today's video we'll talk about the diagnosis of diabetes, so let's get started. Well, there is a certain criteria for diabetes. If you meet any of the following criteria, you are at risk or you may be diagnosed with diabetes. So let's go ahead with that. So in simple words, please get your fasting blood sugar done. If fasting blood sugar is more than 126, then you may be classified as a patient of diabetes. In certain cases, we do an oral glucose tolerance test, where you do a fasting blood sugar test, and if oral glucose tolerance test result is equal to or greater than 200 milligram per deciliter, then the patient is said to be having diabetes. So you may ask your doctor how often you need to be tested for diabetes. Now let's talk about the criteria for pre-diabetes. So you may be diagnosed with pre-diabetes if your blood sugar is above normal but not really high enough to be called as a diabetic patient. You have pre-diabetes if you meet any of the following criteria. If your fasting blood sugar test results they are between 100 to 125 milligram per deciliter, then you may be called as a pre-diabetic. If an oral glucose tolerance test result is between 140 to 199 milligram per deciliter, that is 2 hours after you start the test, then one may be called as a pre-diabetic. The last criteria is if the hemoglobin A1C level, if the results are between 5.7 to 6.4%, then you are again in the risk category, or we call it as a pre-diabetic category for diabetes. So that was all about today's video. In today's video we have discussed about the diagnosis for diabetes. In my next video I'll talk about the treatment for diabetes, so please stay tuned, and please do not forget to like, share, subscribe and comment on my channel, and thank you for watching.